A Bozeman-based company is traveling across the state to train healthcare professionals on how to use and administer Naloxone, an anti-opioid overdose medicine. MTN's Matt Holzappel sat in on the training and explains why it's important.
According to the Montana Department of Health and Human Services, the rate of prescription drug overdose deaths has doubled since the year 2000, with more than 700 of those deaths being caused by prescription opioid overdose. The CDC says that in 2017 alone, more than 70,000 people died from drug overdoses, making it a leading cause of injury-related death in the United States. Of those deaths, almost 68% involved a prescription or illicit opioid. While part of this solution is controlling access to opioids across the country, another part is treating people who have overdosed. Amber Olson of Best Practice Medicine in Bozeman says that Naloxone is just one piece of the solution, but it's a start.
The thing with Naloxone is it's one small piece of a really big puzzle. And unfortunately, someone who has suffered from exposure to an opioid overdose, a lot of times what they need is kind of entry into the system of various social support and additional medical interventions.
Olson was in Great Falls today training workers from Alluvian Health and other organizations to make sure they're prepared should they ever encounter a person who is overdosing. The training is a provision of House Bill 333, which is aimed towards anybody who thinks they might come in contact with someone who has been exposed to opioids.
We encourage them, again, we have people all throughout the state who can conduct this training, and so we try to make those resources as readily available to folks as we can. And so, you know, it's kind of like knowing CPR, knowing how to give rescue breathing. It's very easy to learn, and again, under the House bill, it's being provided free of charge. So there's really not a reason not to know those skills and not to participate in the training.
And while opioids are one of the biggest causes of drug-related deaths, they're not the only one.
There's a lot of drugs that people are utilizing out there, and yeah, a lot of people don't necessarily realize kind of the far-reaching impacts and who that actually involves.
In Great Falls, Matt Holzappel, MTN News.